Is this the first time you are having a pelvic exam?
Yes, doctor.
Good. There is a chance you will not realize I have not done this before.
You have not done this before?
Not on a human. You will be my test patient. What is the worst that can happen?
I don't know. What is the worst that can happen?
I don't know. I guess we will find out. Now if you can please show me where your genitals are.
You don't know where my genitals are.
I am new at this.
But surely you should know where my genitals are.
It's different on every patient.
I'm pretty sure it isn't.
There are variations.
I'm pretty sure there aren't.
Did you go to medical school?
No.
Then I think I am the more qualified of the two of us to know whether or not everyone's genitals are in the same place.
Mine are in the normal place.
There is no normal place.
Are you even a real doctor?
I am a fifth-year medical student.
I thought medical school was 4 years.
Not if you fail your boards.
You failed your boards?
I did not say I failed my boards. I am not legally obligated to tell you that I failed my boards.
I would love to have a different doctor perform this exam.
You came to the free clinic. What kind of choices did you think you'd find?
Doctors who passed their boards?
That is not a choice you find at the free clinic.
At least you are training to be a gynecologist, right?
Gynecology, psychiatry, what's the difference?
There's a big difference.
Not really. Women's problems with their genitals are all caused by problems in their heads.
That is an 18th century way of thinking.
That's all we're up to in medical school. That is why I did not wash my hands.
I would rather you washed your hands.
But they are covered in the mucus of health.
Please wash your hands.
Sure. It's not like I'm going to wash the speculum. It's covered in the blood of other people's health.
Please wash the speculum.
Sure. It's not like the free clinic has clean water.
What is in the water?
Ask the patients in the waiting room with cholera.
Why are there patients with cholera in the waiting room at the gynecology clinic?
Because the cholera clinic is closed.
Why do they have a psychiatrist performing genital exams?
We have to do everything before we specialize. Next week, I'm performing eye surgery.
They're letting you perform eye surgery?
No. I was kidding. Do you really think they would let me near a chainsaw?
They don't use a chainsaw for eye surgery.
How am I supposed to know that? I'm not a surgeon.
I would feel more comfortable if you knew that they don't use a chainsaw for eye surgery.
Look, at least I know we don't use a chainsaw for a pelvic exam.
Yes, that's true. At least you do know that.
Now please show me where your genitals are so we can get on with it.
Like I said, they're in the normal place.
If you're going to refuse to cooperate, I'm going to have to call security.
And what is security going to do?
Hopefully, your pelvic exam.